Basically, a stroke occurs when a blockage of blood vessels interrupts or reduces the supply of blood to the brain. And when this happens, the brain is not receiving enough oxygen or nutrients, and that is when the brain cells start to die off. Some symptoms to look for when you are having a stroke include trouble speaking, and with that, that also means trouble understanding others speak as well. You'll also begin to have paralysis or feel numbness of the face, the arms, and the legs. You'll also have problems with your vision, and that can occur with both eyes or just one eye. You'll also begin to have a headache, and with that, it'll be accompanied with vomiting, dizziness, or altered consciousness. And lastly, you'll also have trouble walking. So you'll begin to stumble, fall, lose your balance. You'll have sudden dizziness, and you'll lose coordination.
There are three types of stroke. There is an ischemic stroke, in which happens when blood flow through the artery that supplies oxygen-rich blood to the brain becomes blocked. Then there is hemorrhagic stroke, which happens when an artery in the brain leaks blood or ruptures. And then lastly, there's transient ischemic attack, which happens or is called a mini stroke, and is different from the major types of stroke because blood flow to the brain is blocked for only a short period of time, usually no more than 5 minutes.
Today we are focusing on a 56-year-old male stroke patient who came into the hospital with acute right-sided weakness and an inability to talk. Upon arrival, this patient received a CT scan, which if you look on the top right-hand side of this slide, you will see that the results are showing a dense middle cerebral artery stroke, which is an ischemic stroke. And if you look at the picture right below that one, you will see that the patient is having no early infract changes in the brain, which is basically showing us that the stroke is happening within a half an hour to 45-minute time frame upon arrival. With that information, the patient is treated with Alteplase IV, which is a thrombolytic medication used to treat blood clots. Our patient was then transferred to the patient stroke center where he was given a CT angiography test. This test is given to allow you to see tissues and blood vessels. And you can see here in the results in figure 3A that there is a proximal left carotid artery stenosis happening where we're having a narrowing or blockage of blood flow. And then when you go on here to figure 3B, we're seeing that now the carotid artery is being cut off of blood, which is now cutting off this issue. So we know that there is a clot happening. With that, the patient is then given a thrombectomy surgery, which is used to physically remove the clot causing the issue. And then when you go in here on figure 4, we're able to see that there is no more clotting issue and that the surgery was a success. Luckily for our patient, after the 5th day, he was able to be discharged with a minimal neurologic deficiency.
In continuation with our case study, our patient suffered from left MCA syndrome or left middle cerebral artery syndrome. Middle cerebral artery syndrome is when the blood supply is restricted in this area and can cause many issues for the patient. As we can see on the right side on the image in the upper left-hand corner, this is where the middle cerebral artery is located. The middle cerebral artery is the largest branch of the internal carotid arteries, and this artery is very important because it supplies oxygenated blood to the frontal, temporal, and parietal lobes of our brain and can affect many sensory functions.
Physical therapy is great for stroke patients. And definitely in our case, we have a patient who has right-sided weakness in the upper and lower extremities. What physical therapy can do is we can assess the patient and discuss with him and his family about their goals and where they want to be. And based off his physical limitations, we can start developing a plan to get him to where he wants to be. With physical therapy, for stroke patients, mostly we want to start off focusing on conventional physical therapy techniques such as assisted moving depending on the severity, and then having them try lifting and moving if possible on their own with no weights, stretching, heat therapy.
There are 3 ways in which speech pathologies help stroke victims. They start off by assessing, diagnosing, treating speech and communication disorders. Therefore, when it comes to stroke, they monitor feeding and swallowing. It is a serious issue for stroke patients to be assisted with feeding techniques and position to prevent choking and infections. They treat aphasia as well, which is the most common condition of stroke patients. In most cases, aphasia makes it hard and very difficult for them to describe their words and put things into thoughts. There are 2 types of aphasia. There's receptive and expressive. Receptive is when they have difficulty understanding language, and expressive is when they have difficulty putting words together and speaking in the correct words. And then lastly, they encourage exercise, but it's not just any regular exercise. It's exercise to strengthen the muscle around the mouth and the throat. For our case study, we came to the conclusion that our patient was affected on the left frontal lobe. We also said that he has expressive aphasia because he has an ability to talk. And some ways that we would treat this is simply by music therapy, which has shown that it really helps patients with strokes. Also some speech agility drills to exercise those vocal folds, and a little bit of word memorization. So maybe like some matching games with cards, that way they would have to say those words. And then lastly, we would encourage them and advise them to do exercise at their house, neck curl-ups and collarbone backups that would help with strengthening the muscles in the jaw and around the mouth as well, and the neck.
As for occupational therapy, occupational therapists help patients complete day-to-day tasks among many other things. So in our case, the patient suffered from a stroke and had right-sided weakness on his body. Usually, the occupational therapist would help him in this situation complete, normal activities such as grabbing objects, reaching for them, strengthening the grip on that side of his body, making food for himself, toileting, dressing himself, things of that nature. So as we can see on the right side, there's 2 images. The top image, you can see the occupational therapist helping the patient grab an object or a ball and put it in the basket. In the bottom image, you can see the occupational therapist helping the patient serve food for himself. So if I was an occupational therapist, I would help the patient complete activities such as these that I've mentioned.
A stroke can damage the parts of the brain responsible for memory, learning, and awareness. A stroke survivor may have a dramatic shortened attention span or may experience deficits in short-term memory loss. Some people may even lose the ability to make plans, comprehend things, meanings, learn new tasks, or engage in other complex mental activities. So the role of a rehabilitation counselor is to provide healthy emotional support with communication and helping the patient get through these difficult obstacles. In our case study, the 56-year-old male suffered left MCA syndrome, causing the right side weakness, which means that he will most likely suffer neglect, which is the loss of ability to respond to objects or sensory stimuli located on the stroke impaired side. This most commonly affects the left side of people with stroke on the right side of their brain. So it can be extremely beneficial to attend to their mental health needs by understanding and offering timely support. And of course, this is not only coming from the rehab counselor, it's also coming from family and friends, doing activities with them involving stimuli for a faster recovery, facilitating coping, and assisting the patient's return to a meaningful life.
Going over preventative measures, while there are risk factors that we cannot control to prevent strokes such as age or family medical history, we can still take actions to prevent having a stroke. 80% of strokes are preventable and around 800,000 strokes occur in the U.S. every year. The number 1 cause of strokes is high blood pressure, and normal blood pressure is around 120/80. And maintaining a healthy blood pressure level reduces the strain on your heart, arteries, and kidneys. And having diabetes doubles the risk of having a stroke. Those who have diabetes can also have high blood pressure, high cholesterol, and are overweight. So to manage the condition to reduce the risk of a stroke, you can work with your doctor. Now, be physically active and take a walk, take the stairs, and just try to stay physically active at least 30 minutes per day. Make the healthy decision of not smoking, because cigarette smoke does damage the blood vessels and raises the risk of strokes. And managing your sleep is always a good way to make your body healthy. So restorative sleep is good for you. And you can go recognize as the symptoms of a stroke by remembering be fast. So balance, eyes, face, arms, speech, and time.